In January, Olympic champion swimmer Nathan Adrian was diagnosed with testicular cancer. Just 5 months and 2 surgeries later, Adrian has already resumed his training. He's not even the first U.S. Olympic swimmer to beat testicular cancer. Just weeks before the 2008 Games in Beijing, Eric Shantou was diagnosed. He still competed, then met with cancer survivors in China.
I've been told that you all look up to me, but I look up to you just as much, if not more.
Then he had surgery.
You know, I knew a little bit about it, but obviously when it hits you personally, you become an expert overnight.
We know even more about testicular cancer today. For starters, it is rare. Just 1 out of every 250 men will develop testicular cancer at some point in their lifetime. Compare that with 1 in 9 men who will be diagnosed with prostate cancer. However, testicular cancer does have a well-earned reputation.
It's a disease of young men, typically.
In fact, the testicular cancer patients seen by oncologist Philip Nevat-Puman of the Kaufman Cancer Center at University of Maryland Upper Chesapeake Health Center are usually between the ages of 15 and 35.
The reproductive cells, the germ cells that we call them, the ones that produce the sperm and reproductive cells, they're turning over and multiplying most when you're young. It's when you're most fertile, and that's often when damage can occur, and then you can get a mutation which causes cancer.
Patients first notice a mass on one testicle. Usually they're smooth. There can be swelling, but not always.
Some people will feel like a hard bump, and that's the most common presentation, is something that feels like a lump that's growing.
Treatment involves the surgical removal of the testicle where the cancer is discovered. That's the bad news. The good news, the cure rate is now 95%, a massive increase just over the past few decades.
If it's early stage, like stage 1, where it's just in the testicle and it hasn't spread anywhere, sometimes it's cured with surgery alone.
Even if testicular cancer has spread, the prognosis can still be positive, both in terms of recovery.
The famous cyclist Lance Armstrong had it, and he had had it spread in multiple areas of his body, including his brain. His was still curable.
And in terms of sexual function.
Most patients who have testicular cancer are able to have a normal reproductive life.
As with other forms of cancer, the key is early detection. But for many young men, that is where testicular cancer gets tricky.
For a lot of boys and young adults, talking about their testicles or their penis is just not something they feel comfortable doing, even with their partner. And so sometimes they will let the mass grow for months and months, sometimes to quite large, just feeling a little shy, basically, or uncomfortable with it.
So talk about it, because when you do, you'll find out that the name is in a whole different ballpark than the facts about testicular cancer.
Testicular cancer is one of the true triumphs of the cancer world. This was something that was responsible for something like 11% of cancer-related deaths in young men in the 1970s. It's less than 0.1% of deaths. So it was something that was very fatal and now is, for the most part, almost always curable.